Hello and welcome to Washington Exec's video series. I'm Amanda Ziadeh with Washington Exec, and with me today is Alicia Harkness. She is a healthcare segment leader at Guidehouse. Thank you so much for joining me today, Alicia.
Thanks so much for having me, Amanda.
Of course. So I'd first like to congratulate you on completing the acquisition of Dovel in October. We recently caught up with Guidehouse partner John Sod regarding how the acquisition impacts the national security segment. So I'd love to start by asking you how the acquisition impacts the healthcare segment, what this adds to the portfolio and what it means for the healthcare segment going forward.
Absolutely. Well, we're really excited to have them on board. When I think about us working with organizations throughout the healthcare ecosystem, it's really important for us to think about not just the strategy and management consulting that we do, but also thinking more broadly about the digital transformation that we must bring to the table, and cybersecurity, and the significant technology demands on the market. So in particular, when I think about Dovel, we're really excited about the capabilities that they bring in advanced data analytics, in AI, in digital modernization. All of these capabilities with cloud adoption and infrastructure optimization really complements our core capabilities of the historic Guidehouse. So we're really excited about some of the new alliances that we're strengthening with the help of having Dovel on board. When I think about the strengthening of our low-code, no-code relationships and Salesforce, Amazon, Microsoft, these are all partnerships that we've been able to extend through our now relationship and merger with Dovel. But we believe that technological innovation is really important. And when I think about improving some of the inefficiencies in the market, some of the collaboration that we've been doing with Guidehouse Digital has been really important to enable improvements in the care continuum or scientific discovery. So we're thrilled about working with these organizations on cloud-enabled interoperability to connect and coordinate care in ways that we weren't able to historically. So these are all great things, having the new capabilities. We're really integrating science and technology now for our clients. It's enabling us to do great things around bringing vaccines to market, therapeutics and diagnostics out to the market faster. So we're looking forward to what 2022 will bring and beyond. But beyond digital and AI, machine learning, analytics, there's a lot of other capabilities that Dovel has brought, and we're thrilled about the cybersecurity extension as well. So that's another area. And when I think about some of the trends in the market, cybersecurity is obviously one of them. So the additional capabilities have been really strengthening to the Guidehouse brand.
All right, wonderful. Well, speaking of trends, as we settle into 2022, what trends and focus areas are you preparing for this year in the health industry?
When I think about healthcare trends, there's really a few that have been front and center. And we really have to think about how, historically, healthcare was a pretty stable market and has experienced a lot of volatility over the course of the past year or two with the COVID-19 pandemic. So we've had to pivot to addressing some new trends. And one of them has really been thinking about the market differently and collaborating more across the ecosystem, that the public and the commercial has to work together to solve some of the most pressing challenges in a pandemic. Digital care delivery is different. We're having to address, some of the well-capitalized disruption that's taking place. I would also say that there's increased demands around price transparency, and our customers are having to contend with that. But when I think about the largest trend, I would say workforce shortage is really front and center. And we all have seen that concern play out in the pandemic. Staff are stressed, they're overstretched. It is one of the largest concerns of any of our clients right now. When I think about nurse turnover, I think the statistics over 15% and over 43% of physicians in a recent study have been talking about retiring. So these are all significant concerns that have been front and center in the past, but the pandemic has really accelerated those concerns. And our clients are really having to address now not just the clinical shortage, but also the non-clinical frontline staff who are also very tired, very concerned about the fact that they can also get paid potentially more at a Target or Walmart than even being in the stressors of the health ecosystem. So this is something that we're spending a lot of time talking about, the pace of change when it comes to workforce transformation, what needs to happen to reshape the workforce, how we look for opportunities to reduce the consumption of services, and where possible to add new technologies to be able to take off some of the pressure on the workflows that these clinical and non-clinical staff in the healthcare community have been stressed and stretched to serve. So these are all some of the things that we are seeing when it comes to the number one trend, which I would say is that workforce shortage. Mm-hmm. But I would transition then also to think about some of the capital issues. Significant investments have needed to take place around the capital, and it's less about physical presence, but the innovations that are being demanded and the capital costs to address some of those care continuum changes. Another trend I would say is the energy consumption. A lot of discussion around social determinants of health and how we need to think about the health system to reduce the energy consumption that they're spending. An interesting statistic that we talk about with our clients is that energy is typically comprising 51% of a facility's expenses. So obviously, that cost can't continue to rise, and knowing the additional expenses that we're trying to invest in the ecosystem, we need to look for ways to reduce the costs for energy. And what's interesting, and a lot of people don't connect the dots, is the connection between energy and social determinants of health. And air quality and water quality are all considered social determinants. And given their effects on the physical body, whether it's gastrointestinal or neurological, these are all really important things for us to think about, and more discussions are taking place in that space. And then I would wrap it up and say the last trend that we're seeing a lot of discussion about is cybersecurity. And it really is stunning the amount of breaches that are taking place. 82% of our customers are talking about breaches that they have contended with in 2021. And we see that continuing in 2022. There is a lot of attacks that are happening, and it's more than just addressing a physical system. We have to look at cybersecurity across all the business processes, not just the hardware that has often been thought of in having to be addressed for cybersecurity. So doing a lot in that space as well. But overall, hopefully we're heading into an endemic and out of the pandemic phase. Mm-hmm. It is interesting to think about what we've learned over the course of the past 2 years since 2020, mm-hmm. and how we can continue to monitor the types of risks that the healthcare ecosystem is confronted with, and what we can do to modernize our thinking about what the market is going to need looking forward. And, I keep on talking about how we can do better as an organization by collaborating with one another, bringing both an appreciation for what the public health community needs and the commercial health community needs, and solving problems together. And that's what we look forward to doing most in 2022.
Wow. I mean, you are in my opinion, one of the most important industries in our world, essentially, right now. So these priorities or these trends seem like some of the most pressing in the country. I can't imagine, especially after these past couple of years, new challenges arising, already having to, continue innovating and dealing with already the healthcare trends and challenges in the country. So, are there any other challenges or risks the health industry is facing? I know we just covered a few of them that you're focused on this year as well.
I think the only other thing that I would say that we have to recognize is price transparency. A lot of time has been spent in the price transparency space and new legislation that we have to think about how we adopt that into our community, both from a payer and provider perspective, incorporating those public policies. So that would be the other thing that I would add to the list. But I'm just excited about what we've already been able to do to make a footprint, a positive impact on our community. You know, we spend a lot of time at organizations like the VA where we've been able to, you know, think about those individuals that are most at risk for committing suicide and doing a lot of data analytics there, or helping address the community care needs, enabling veterans to gain access to the community providers, or over at NIH, where we're working with HHS and helping get vaccines to market faster, or even working with the BioNTech or Moderna vaccines, thinking about the regulatory issues and monitoring those outcomes of getting the vaccines to market. So it has been a very impactful year, but it is an exciting set of opportunities looking forward.
Well, finally, just want to ask if there's any other plans that you have as a healthcare segment leader to approach these challenges and help customers overcome them going forward. I know it's a loaded question, so don't expect all the answers right now, but any strategies that you're thinking of?
One of the strategies that we've been spending a lot of time is the development of our people, making sure that they're gaining access to the best certifications and developing their careers to be able to bring the best of themselves to our clients. Our clients will only receive the best quality service if, in fact, that they're also receiving service from people who are happy, are getting the career experience that they want, and the breadth of experience across both the public and the commercial marketplace. So that's something that we see as critical moving forward. And then further integrating the Dovel transaction, what we call as a merger, because it is mergers of two organizations coming together to create, significant strength for the market. And really excited about furthering those connections and those relationships moving forward.
Well, thank you so much, Alicia, for sharing this with us and for the work that you're doing at Guidehouse. I appreciate you being here today.
Well, we're honored to be able to do it, and thanks for having us.